In areas where vaccine coverage is low, cases and hospitalizations are starting to climb again.
My greatest fear is that patients continue to pour in and we're unable to give them the care that they need because we don't have staff or resources.
We have the tools to end this epidemic. It is up to us to utilize those tools to their maximum.
Well, the concern is growing all across the country as COVID cases begin to rise in several states because of the Delta variant.
Hospitals are seeing an increase in COVID patients, especially those who are unvaccinated. The CDC says the Delta variant accounts for more than 80% of those new infections. Here in Arizona, we've added another 1,043 cases to our state total, and 10 more Arizonans have died from complications of this virus. Our average positivity rate for testing since Sunday is now at 13%. It's at 10% average for the month of July. Nowhere that we want to be right now. So we want to bring in Dr. Cara Christ, who's the Department of Health Services Director. Dr. Christ, thank you so much for joining us. It's been a while since we've talked to you. Obviously, these trends are disturbing, especially as just today we're seeing kids go back to school. And I know you're aware about the Academy of Pediatrics suggesting masking up for kids as they return to school. So parents are concerned. What is this going to look like to you?
So we are concerned, and we are seeing an increase in the number of cases here in Arizona. We attribute that to the very contagious Delta variant. We're seeing it in all parts of the state. Our best recommendation is to get fully vaccinated. It's the best prevention that we have against COVID-19.
So, Dr. Christ, obviously some people out there might see that 1,000 number and go, well, when you look at the millions of people in our state, that's not a huge number. How do you see that number? And will we ever get to a point where it's zero?
So we believe that COVID is going to be with us. We would love to get to zero. As long as it's circulating in the community and as it's contagious as it is, we anticipate that it's going to be here. What we are seeing is that this is primarily impacting unvaccinated individuals. 90% of the cases in July have been in unvaccinated people, and 99% of the deaths since January have been in unvaccinated individuals. We do recommend that you get fully vaccinated as soon as possible, and if you are not vaccinated, to wear a mask whenever you are out with people you don't live with.
Kids who are under the age of 12, of course, are not eligible for a COVID vaccine just yet. And as they head back into the classroom, we know that the governor has enforced or made a mandate that the schools cannot require masking. So where does that put us? And are we then at greater risk of maybe seeing a repeat of needing to go to remote learning? I mean, would we be discussing a change in policy for masking up prior to that?
So the best place for our kids is in school. While schools aren't mandating masks, parents still have the option to send their kids with masks. I've got 3 kiddos, one who's fully vaccinated and 2 who aren't old enough to be vaccinated. They start school today and they will be wearing masks. I don't want them getting COVID. I don't want them bringing COVID home to me or to some of our high-risk family members. And so they will be wearing masks. That's my choice. That's a choice that each family has to make, but we would highly encourage, especially if they're unvaccinated, have them wear a mask while they are at school.
So you see what's going on in LA County. They've got the mask mandate back. Some people might be for that, others against it. Do you ever see something happening like that here in Arizona?
Given recent legislation that was passed, I don't see the mandates happening back in Arizona, but our recommendation this entire time has never changed. If you are unvaccinated and you are out in public, we would recommend that you wear a mask. What we are seeing is this pandemic is shifting from a general pandemic to a pandemic in the unvaccinated.
And Dr. Christ, we're very tight on time. Just quickly, how do we know when these cases are the Delta variant or not? How are those tests being done, or where do we get those figures?
So we send a random sample from laboratories in Arizona to a couple of our partners that can do the variant sequencing. It's a random sample. Not everyone gets tested, but it gives us a good idea of the proportion. What we would say is we know Delta variant is here in the community, anticipate that that is the one that's becoming the most predominant strain and likely what someone's going to come into contact with. It doesn't change the treatment. It doesn't change our recommendations. Our recommendation is to be fully vaccinated. That's the best protection we have against Delta variant.
Dr. Christ, thank you so much for your
It's
time.
always great talking to you. Thank you.
Appreciate it.